In my practice, I do a lot of gender affirmation surgery, especially for transmasculine folks. And in an effort to be as inclusive as possible for top surgery, for example, I do not have a BMI limit. And more recently, I'm seeing a lot of my former patients go on to lose weight with the newer medications such as Wegovy or Ozempic, and subsequently come back for more body contouring surgeries, but these surgeries need to be gender affirming as well. So one of the procedures we offer folks in this category is a masculinizing tummy tuck, where basically we're doing body contouring, we're getting rid of loose skin, any curves left behind, but we're also at the same time really masculinizing that torso and being very careful to get the correct proportions in order to align the body and the abdomen with the patient's gender identity. So there's a few specific things we'll do in this masculinizing tummy tuck, which I'm going to run through in this video. So with a masculinizing tummy tuck, almost every patient is also going to get liposuction. So typically the areas I'm attacking with the liposuction are the curves. We're going to want to get that hip to waist ratio closer to 1, which is a more masculine silhouette. And not only that, but I'm going to get more definition. So we don't just have a flat abdomen. We instead are beginning to see some abs under there. And depending on the patient's body fat percentage, we may see more or less abs, but we're definitely going to be doing a liposuction to the abdomen that is left behind. We're going to want to see straight lines, and this goes for the scar. Thankfully, the tummy tuck scar tends to heal a lot better than the top surgery scar, so ultimately this should hopefully disappear, but we're going to want to see it low and straight. The other subtlety of masculinizing tummy tuck is we have to be really careful with what we do with the six pack. So typically during a tummy tuck, if there's any weakness, bulging, or separation of the six pack, we're going to correct that, we're going to fix it. But in somebody who is female identifying, we're going to want to cinch in that waist aggressively in order to create that hourglass frame, which is absolutely not what we want to do if we're masculinizing the torso and the abdomen. So we're very keen to avoid this in the masculinizing tummy tuck and not to cinch that waist too tight. The other really gratifying thing about the masculinizing tummy tuck is we're usually able to get rid of a lot of loose skin, and especially skin that has stretch marks. Usually we can get a great improvement in the appearance of that. It's a very gratifying procedure. Oftentimes we're combining it with another procedure, like this particular patient had revision at the same time, but you can do it just by itself, and it's ideal in folks who have lost weight.